Hi, I'm Elizabeth Hess. I'm here with the administrator of the Champaign-Public Health District, Julie Pryde. Good afternoon, Julie.
Hello.
So we are now in phase 3 in the state of Illinois, and things have opened up. And as I move around yesterday in restaurants and downtown Champaign and along the protesters, there are a lot of people not wearing masks. Are we going to brace for another outbreak in 2 to 3 weeks?
Absolutely. It could start within a week to 2 weeks. Hospitalizations, if there are any, usually start, you see the deaths or hospitalizations within the third week, which obviously we hope not to see. But yes, absolutely, we're going to see more cases. We already had a high level of COVID moving around in our community. And then as more people get out and start mingling and the masks aren't being worn, we absolutely are going to see more cases, and we are bracing for that.
And there are protests out there and people aren't wearing masks to those. I know you're speaking at one, and a lot of people are social distancing and being responsible, but a lot of people aren't wearing masks. Is that going to be another source of an outbreak in a couple of weeks?
Absolutely. Here's the deal. The virus does not know whether you are at a picnic, or if you are at church, or if you are at a protest, or if you are at a graduation party, a birthday party, seeing someone you love, or at work. It doesn't know, it doesn't care, and all it's looking for is a way to move from person to person to continue to exist. So every single opportunity that the virus gets to move in a naive population, which is what essentially we are, the whole world, it will continue to infect people. So it just does not matter what you're doing. If what you're doing involves being close to someone who's not in your household and not wearing a mask, you are at risk of not only becoming infected, but also potentially passing it if you do not know that you are infected.
This past weekend, beautiful weather, plus the fact that we have moved into phase 3, so people are outside at restaurants. Every place I went, the servers, the bartenders all had masks on, but we can't if we're eating and sharing conversation and sitting at a table. With that said, are we going to just spread the virus from us to the servers, then back to their families? I mean, is this not a perpetual cycle that we're not going to be able to break?
Well, so first of all, hopefully not. The servers are wearing the mask, yes. People are to wear the masks when they go in and when they sit down, and go ahead and continue wearing them and if the server is around. Obviously, you can't eat while you're wearing the mask. So it's just, people are just encouraged to keep it on while you're just sitting and chatting if somebody is around you. Otherwise, you feel free to take them off. But you need to, when the server comes around, ideally you put it back on or cover your mouth and nose, because yes, if you were asymptomatic, you could indeed spread that to your server.
About 2.5 to 3 weeks ago, Florida was the first state to reopen, and now they have seen a lot of spikes in cases, and they are also declaring many cases pneumonia cases. They're not calling them COVID. Are we just sort of sugarcoating exactly what it is? Isn't pneumonia case that's diagnosed right now likely COVID?
Of course it is. I don't know what the deal is with that. I would assume that it has to do with, so at the beginning of a pandemic, oftentimes when you have the disease first showing up and you don't know what it is, you're going to name it like undiagnosed pneumonia. At the beginning of HIV, they were naming the different opportunistic infections. But once you know what's causing it and there's a test for it, then there's really no excuse not to report it for what it is and not to name it for what it is. My guess is that they just don't have enough testing capacity down there. It's not as accessible as it is in Champaign-Urbana. And so people are showing up at the hospital with pneumonia. It'll go as classified as just pneumonia until they are able to get test results back, if they indeed are.
I'm glad you brought up testing. CVS started offering testing as of May 31st. I want to make sure if people go to CVS that CUPHD will get those results. Are they coordinating with you, or how does that work?
So with COVID-19, it doesn't matter where you test, as long as you are testing and using your correct information, it's going to come back to the health department where your residence is. So you could even test at a CVS, in California, if you are out there on vacation. And if you are positive, we're going to get your test result. It's a reportable disease, and that's how they work. So the health department gets it so that they can then follow up with the person. So yes, we will get them from CVS. We get them from every place that does testing.
I know that there's been testing at Marketplace Mall, successful testing. Yesterday, there were some protests out there. Has that disrupted the testing, to your knowledge?
It is closed down for today. I think they're probably just evaluating everything. It will, as far as I understand, it will be back up and going again tomorrow at 8 a.m. But at no point has, the Carl testing stopped. So if people would like to test today while the mall site is closed, they can call our COVID hotline at 239-7877 and get a code, and then be able to go out and test.
As people move about the county right now, and you're keeping track of numbers, today Champaign-Urbana has how many? Champaign County has how many cases of COVID?
Well, cumulative total of 632 cases. We've done now 15,073 tests. 134 of the 632 cases are active. So that means that 134 people right now are known to have active infection, and they are in isolation. We have a total of 491 that we know have recovered, and 6 that are currently hospitalized. And luckily, there haven't been more deaths than the initial 7 that I've been reporting for weeks.
I know I ask this every week, but is that number up or down from last week?
Which number?
The number of active cases right now. Are we trending up or trending down?
Well, I'd have to look back, but I think right now that the number of active cases, we were starting to, it got really high there for a little bit, and then we were starting to taper off. We had the one big outbreak that caused a lot of other outbreaks, and we are finally starting to get everybody into isolation or quarantine or tested from that, and now they're coming out of their infectiousness period. So it may actually be a little less. I hope that trend continues, because we know we are going to see a spike here soon.
As my friends have to report back to the University of Illinois, a couple of places need to have temperature checks before they can walk into their offices. Is that really effective, or it's possible they could be asymptomatic and they're not even showing a temperature yet?
Yeah, so a couple of things can happen. The temperature check is just one way of kind of having an actual non-subjective thing that you can look at to see, do you have a fever? The problem with that, of course, is that not everyone that is infectious with COVID-19 has a fever. Even people who are sick with it don't all have fevers. And then, of course, if I wake up in the morning and I don't feel well, I'm achy or whatever, the first thing I'm going to do is take an Advil or something. So people take fever reducers, and not necessarily to, try to go to work while they're sick, but just because they might not think of it. They just might not feel well and take that. So people are asked to self-monitor, and they're going to be asked to self-monitor for symptoms all the time. If they get any symptoms at all, they're asked to immediately isolate and then, go home. So that'll be going on, as well as testing and social distancing and the masking and everything as well. So it's going to be, all those things are going on. But yeah, so taking a temperature is certainly not a foolproof method to see if somebody is infectious or well or anything.
So wearing a mask is obviously the best defense we have to protect you from my germs. As we enter phase 3, does that mean we can move about freely with a mask, or where are we in phase 3?
No, in phase 3, as throughout the entire pandemic, a couple of things are going to have to continue no matter what phase we're in. That will be wearing a mask when you're in public. So always have a mask with you, always have a mask on when you're in public, and then stay 6 feet away from others still. Just because we're in phase 3 does not mean that you can just go around and be around people and visit them and be close to them. Unfortunately, that still cannot happen. People have to wear the masks and remain 6 feet from everyone. So that's key. And then, of course, the continuing with the increased hand washing is also going to be something that we're going to continue to stress.
I had to do errands, and one of the places I went was the UPS store, and praise the UPS workers, everyone had a mask on. The three men inside, none of them had masks on. How should I handle this? Should I politely ask them why they're not wearing masks? Should I mention it to management? Should I call your office? What do I do?
Well, I would mention it to management. I would, don't confront the person. I think that is not going to be beneficial. Some people legitimately cannot wear masks because of breathing problems, but a lot of people just aren't wearing them. Either they don't understand the importance of it or they just don't care. However, whatever the reason, it's putting other people and workers at risk. So mention it to the management at the store. Stay away from the person that's not wearing the mask, and then tell the management that you're not comfortable with that, and ask them if they would consider a mandatory mask requirement for their business. They certainly have that right to do that to protect their employees and also the community.
As we prepare for more and more things to open up, and as you and I brace for more outbreaks in 2 to 3 weeks, should we not plan past the end of June? Are we in a wait and see mode right now?
Well, absolutely. I mean, that you always plan for it. I mean, if you're a business or something, start planning for it. But we are moving along this based on the data, based on the metrics. So if we start seeing spikes in cases and hospitalizations throughout our region, because remember, it's not just our county, it's the entire region. So if we start seeing that and the hospital systems start to become overwhelmed, then it's likely we either will not move, progress to 4 at the end of that time, or that we, if it were to get too bad, then we would have to even move backwards. So it is not something that we can speed up through wishful thinking or by pretending that it doesn't exist. It's just something that we have to try to keep from spreading as much as possible. And there's really only a few ways to do that right now.
And you don't have a crystal ball to say, yes, school will resume in August and the university can reopen and dorms will be full. You can't predict any of that.
Nope. I mean, you can always plan for things that could, where we could get to, because you can't wait till the last minute and plan for that. But no, I have absolutely no way of knowing where this is going. Had you have asked me, just not too long ago, where would we be right now, I wouldn't have been able to predict all kinds of things. Protesting and protests about wearing masks, or protests in relation to all of the events that have been happening related to police violence. So I mean, I wouldn't have been able to predict that. So we just have to see what's happening. I mean, I guess I could have predicted people showing up in large groups around, the Ozarks and places like that, and just completely ignoring the guidance. But the other stuff I couldn't have predicted. So we just have to see what the data shows as we move along. And are we threatening our healthcare system, or are things remaining stable?
While I have you here and you have a mask in front of you, as you always do at arm's length,
Yeah.
Could you just demonstrate the inaccurate and ineffective way to wear a mask?
Sure. So, this is your basic little double cloth ear loop mask that you just put on. So being the Abe Lincoln is not effective at all. I see so many Abe Lincolns out there like this. Not effective. Do not do this. This is doing absolutely nothing but making your ears look ridiculous. So if you put it on like this, and your nostrils are also, you're still breathing out, it may be more effective than nothing, but it's not effective. This is the effective way to wear it. If you have one that has a nose, little clamp on it, you press that down, and then you just put it against there. It needs to cover your entire face. I've seen people wear little tiny masks like this, little tiny ones that are kind of weird, but just make sure that your whole nose, your whole nostrils, and your mouth are covered, at all times. the rest of it is pretty simple, and it doesn't matter what you cover it with. But I see all kinds of things. This also is not particularly helpful, although I can understand it. It does get rather warm in there. But this is it. You just put it on, just take it off, put it on. Luckily, I have some big honking ears that it can hook onto, but there's all kinds of masks out there. So if you find one that is not fitting you well or not comfortable, find another one. We did have a huge mask shortage, but thanks to our community, everyone out there that's making masks, still turning them into public health. A lot of local manufacturers are making and selling masks now. There are paper masks for sale, or the little surgical masks. So there's really not a mask shortage right now. There still is a mask shortage for healthcare workers, but not for the general public. And if you don't have a mask and you're not comfortable in a mask, then you can also wrap a scarf around your face or tie a bandana.
And I like you to have the last word. Peaceful protests, part of public health. We're protesting that everyone be safe and be healthy. Your last word on how people can do this in a pandemic?
Sure. I mean, there are a lot. There's no reason that people cannot protest or have rallies or anything like that in a safe manner. There's lots of ways to do that, but the main things are, number one, wear a mask. Number two, stay away from 6 feet away from anyone, and that's not just 6 feet on the sides, it's 6 feet all the way around you. Stay away from people. So the protest has to take up more, real estate, if you will. It's got to be a lot bigger. Stay away from people. If you are at risk, either consider not going, or doing it virtually, or staying at the far fringe of it, so that you can make sure you get away from people. People at the front have more of a tendency, people to kind of scoot in on them, but don't hesitate to ask people to step away from you, because it's just still not common. It's still not a common thing for people to do. We're used to not being 6 feet away from everyone. So sometimes we all, including myself, just need reminders to step back. But those are the main things. Don't hug or hold hands or do things like that. Just stay 6 feet away from each other, wear your mask, and then there should be no problem with any type of protest or rally.
And CUPHD's hotline number one more time. I think we can put that on the screen as well.
Okay, yep, it's 239-7877, or you can send us questions at coronavirus@c-uphd.org.
All right, thank you so much for doing that. That's to our producer, Jason Liggett. Also to Urbana Mayor Diane Marlin. I want to thank you for letting us do these. CUPHD, I want everyone to stay safe, but most of all, thank you so much to the administrator of the Champaign-Urbana Public Health District, Julie Pryde. Thank you for your time.